The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Definitely going to have to start today a little bit different because I'm starting to feel like, Brandi, that you're a co-host of the program, but just starting out a little differently because you've been here so much. Brandi Hooker Evans, say hello to everyone.
What's up, guys? I am so glad to be back today.
Glad to have you here, as always. Appreciate the time that you spend with us. The knowledge and experience that you share is invaluable. So you're here for another episode of the Dental Brief. We'll get that out there. Brandi, I think our listeners know your background. If not, I'm going to encourage them to go to your website, which is brandihookerevans.com. So maybe pull that up while we're chatting away here. Brandi, what's new? What's going on in dentistry?
Well, I know that I had homework from you last time, so I am super pumped to dive into that. I just got home from the Dental Entrepreneur Women's Retreat in Charlotte, North Carolina, and it was such a great reminder of how important it is to take risks, even when you don't know what the outcome is going to be.
Right. I think we never know what the outcome is going to be, right?
No, but there's safe and steady paths, and then there are paths that have exponential rewards available to them, which is what you gave me for homework last time we met. And that was, how can we pay hygiene more and make the transaction of getting patients healthy more profitable for everyone? Mm-hmm. So you know that I believe wholeheartedly that money should never be why you do anything. I think that that's cart before the horse and always a recipe to fall on your face.
Yeah, I think obviously we all need to make sure that we pay the bills, right? You're not saying that, hey, you should open up a free dental clinic, right?
No. And one of the ways that we can gauge whether or not we are addressing and treating the disease that's in our practice is by what the production looks like. Because we know that half of our adult patients have mild, moderate, or advanced bone loss and versions of periodontal disease. That has been, no matter the demographic of patients, whether you're in a rural area, a bougie area, a poor area, it doesn't matter. Like, at least half of our patients have gum disease until we get to the age of 65, and then it jumps up to just shy of 3/4. With research that was released 10 years ago, and we have seen the disease burden of our population only increase since that big data from the ADA and the CDC came out. So what does that mean for us? Well, I think that as a hygienist, if you want to make more money and be more profitable, the number one way to do that is to look your patients in the eyes, recognize their disease, and let them discover it for themselves, and then do something about it. So then the production naturally increases. Fair?
Yep.
Well, then, if you're making an hourly wage, people start to feel like I'm not being compensated for the work that I'm doing. So here's where it gets tricky, Patrick. My belief and my experience as a clinical hygienist is to let go of the idea of just being someone's employee, and just similar to you said, maybe you should be a co-host. Maybe as a hygienist, you ought to own your own career. You might not own the building, but you can own your own career. And if you set yourself up with your doctor that you're working with in such a way that you treat your hygiene career like you are an associate of the practice, that you are an owner of your own career, everyone starts to win. Because in associateships, there's all the risk, right? Like, when you sign on as an associate, you work and your production and collections dictate what the paycheck looks like. And what are your thoughts on that before I start to?
Yeah, so I think one thing that I'm hearing, right? So it might not necessarily be what you're saying, but it's what I'm hearing is that you believe strongly that hygienists need to empower themselves and be empowered, right? To be able to almost run, not like almost run a subset of that practice for themselves, right? So they need to own that and they need to be good. And so let me kind of maybe not say this in such an elegant way, that if they're doing a great job of taking care of patients, if they're doing a great job and an extraordinary job of diagnosing, of working with a dentist on diagnosis and treating patients right, which is building confidence, trust, communicating with them, that the amount of disease that they're going to convince patients that needs to be treated, right? Or as you said, patients recognize that it needs to be treated. Patients are going to have that treatment. The amount of revenue is going to go up significantly as a result of that. I mean, that's what you're saying, right?
Correct.
Yeah. What do the naysayers say? What's the flip side of that?
Well, they want to be guaranteed a wage. They want to be in a safe little cocoon where they're getting all of the rewards but not taking any of the risks.
Yeah.
And then from the owner side of the practice, it's, well, if I do something like that where it's a production collection commission based, then I have to worry about the trustworthiness of the clinician. I have to worry that the clinician is going to be rude to the front office team for not keeping their schedule full. And
Right.
I'm going to have a clinician where the teamwork is going to go right out the window. If they don't have a patient, they're going to hit the road. There will be no sharpening, no bathroom cleaning, no booger wiping off of the front door that happens with their less set of patients, because that's not my job.
Right.
And so what I would love for people to do is envision this world where all of those problems naturally melted away because you had so much respect for yourself that you were going to show up in your career where you got there on time and helped everyone get ready for the day, where you asked the front office, like, what do they need that could be helpful, that you see the booger on the door that the kids left and you just go take care of it without having it ever be a thing.
Right.
And you pitch in and you help with your schedule. And when you have a cancellation, you aren't unkind to anyone. And you're so incredibly proud of the work that you do, the team member that you are, and that the human that you're becoming, that all of those naysayers from both the hygiene perspective and the practice owner perspective just melt away. I've seen it and I've done it. And here's the deal, Patrick, when I work clinically and I operate that way, it's you become, it's not just me. Like, if I can do it, anyone can do it. But what I've seen people do and what I've experienced myself is so much career satisfaction. And as a hygienist, definitely more money than I could have ever made in a traditional sense. But you become the person that everyone wants to have on their team, because you're not showing up for yourself and looking out for number one and selling case acceptance. No way. You're guiding patients to diagnosing their own disease. You're ready to help them with it. And by golly, you're the first one at the practice in the morning, ready to make sure that everyone has a great day.
Yep. Let me ask you this question, kind of tricky, because we talked a little bit about income. And I know that there's a lot of different pay plans that work for the dentist and the hygienist. What is the best, but what is one that you've seen work incredibly well for everybody?
Well, my favorite with a person that's going to own their own career is a commission-based. You've seen it range between 30 and 35% of collections is the typical, but you really truly treat it like an associateship within the practice. Like you said, that subset of the practice, because the hygiene program really is its own program and it supports the restorative program. What is it? 80% of work is diagnosed in the hygiene chair, right? This is a big place, but it's a leap of faith, because hygienists, we are born and bred to be employees, to clock in and clock out, to do our thing and go home. And I would just invite people that are so excited to recognize and treat disease to also recognize their career and nourish it.
Yeah.
It's scary though, Patrick. This this is scary. It's a complete disruption to decades and decades of a different way. So.
Right. And what typically happens, I'll tell you, if you run out and you change, you go to a commission-based compensation-based program in your practice, more than likely you'll have a bad experience. But if you try it again, you'll probably have a good experience. I hear this all the time. People do something one time. They say, oh, I tried hiring there. It didn't work out. That's horrible, right? I tried that one time and didn't work out. When you're talking about people, it takes a lot of hires, usually, unless you're very, very fortunate and lucky, to get an amazing hire. So if you think about the amount of people that you've had work in your practice over time that wouldn't work out by that plan, you should never hire anyone again because they're probably not going to work out, right? Just never do it again. Just you do everything.
Right.
Which I think for some people, if you are one of those people that thinks maybe I'd be better off if I did everything myself, you should keep listening to this program for sure. Yeah.
Well, we're all given gifts in accordance with the calling that we have. I mean, use whatever vocabulary you want for how you operate from the inside out. But we're given what we need in order to answer the calling we've been given. And one of the things that I've noticed when people are called to more and they don't answer, it makes them bitter and frustrated. Exactly. And in this situation, it's scary for both the doctor and the hygienist because the hygienist doesn't have guaranteed pay and the doctor can end up with the prima donna on their hands, like whether they're, hygiene men and women are meaning for that or not. But if you have clear expectations from the beginning, you discuss what a partnership looks like, you discuss what being an associate in this practice looks like. It's the same thing when you hire another dentist. If you have someone that shows up and slides in as soon as the hygienist has got their first patient numb and slides out before everyone for lunch in the end of the day, you aren't building a great culture anyway. And so this invitation that I'm giving is a real leap of faith. It just is. But if you set it up well, and if you are continually checking in with one another, operating from your core values of who you are as a human being, what you want to be known for in your own heart, in your own mind, when you walk out the door, it works so well. And what I've noticed with so much disease present is that typically you're working enough that even if you have a couple of cancellations, the idea is to freaking enjoy them. Because tomorrow's not going to look like that. You're going to work through lunch and whatever else might come your way. But man, you get a little gap in the schedule. And if you can believe that over the weeks and the months, that the balance of the production is going to happen, just like in the dental chair, it does. And I've lived it. I've watched colleagues live it. And when done well, this eliminates so much drama out of everyone's life. And it really does have the reward benefit the hygienist, the practice, the owner doctor, as well as our number one, which is the patient.
Yep. Makes a lot of sense to me. It actually popped in my head when you were talking about no shows that you should have an SOP. You should have a go-to list of here's what we can do when we have a no-show. Right? Maybe 15 minutes of that is working on better programs and policies. I think policies is a bad word to make sure that you have a great system in place to limit the amount of no-shows, right? A way to work on those. So that should be part of what you're doing. But there's a million other things that you can do to improve yourself when you have a little unexpected free time, right?
Absolutely. Yeah. And never underestimate the value of walking into someone's operatory or workspace. This could be front office or back, and just go lend them a hand. And sometimes, I mean, they looked like they were just fine, but man, you go crack a joke and laugh with the patient. Yeah. What that does for the office, like even if you not even clean for them, not even whatever, but just go over and share a little bit of light.
Right.
That can be incredibly valuable. And when you're running behind, that other clinician, whether it's the assistant or another hygienist or a doctor, is going to pop over and be ready to help you and manage your schedule when you're behind just because you went and shared a little love with them. I mean, it's not all rocket science. And I know that so many times people accuse me of being such a Pollyanna, Patrick, and you know this about me. But when people put it to play, it works. And that's why I'm so optimistic, is because I watch it over and over and over again. And if you use half your heart and half your rear, it doesn't go well. But you put both of those in and there's no limit.
Yeah, it's a great way of putting it. And it fits you. Brandi, I'm going to give the audience the website one more time. It's brandihookerevans.com. Go check it out. Check out her prior episodes. Check out her social. Brandi, thank you so much for being here. We appreciate you so much.
Thanks, you guys. Take care and have a good day. I'm so happy that I get to do dentistry with y'all.